Hi everyone, Jackie from Waterlily. Again, just wanted to take a moment of your time, and what we're going to do today is go through dermal rolling. So I'm just going to show you a little bit about how we would do a home roller treatment in the clinic, and then Lana's going to also show you how she would perform the treatment on herself as well at home. What we're going to be using today is an 0.2mm roller. So this is perfect for home use, and you can get very good results with it. So you can be misled with the depths that you want your home rollers to go to. We will always start on an 0.2. You can sometimes start on an 0.25. They do go up to an 0.5, but that's through progression, and generally an 0.5 is more used on the body area, but we're just going to focus on the facial areas for today. So it comes in this little case. We have already cleansed and prepped Lana's skin, so there's no makeup residue or anything on there. So when you are using your home roller, please do make sure that you're working with a completely clean canvas. Just make sure that there's no heavy residues of fake tan, makeup, anything like that, because we don't want to push that into the skin as well. So just taking the little home roller out of the case. Just there. So this is a brand new roller. As you can see, the little head unit on there rolls, and then it's got your little 0.2mm needles just in there. The great thing with the Ultraceuticals roller is the needles are very close together in proximity, and what that prevents is the flicking effect. So when you're running your roller across the skin, as you can imagine, as it's going around in the circular motion, as the needles penetrate the skin and then come out or retract, they can flick a little bit. Being that these needles are they're very small and very, very close together, they're in and out very, very quickly. So you're not getting any tearing or micro scratches within the skin, which is what we want to avoid. So just be mindful when you are purchasing your home rollers. Make sure you're getting a really good medical grade roller where the technology is very up to date and it's going to do or perform the treatment appropriately for you. So if Lana can just turn her head to the side. So virtually just holding your home roller and rolling it up and down the skin. To start with, you want to sort of do it 6 to 8 times. So 1, 2, 3, and so on. The biggest thing you need to be careful with your home roller when you're doing it is not to drag it across. You will scratch the skin. So when you're applying it, go in your up and down motions, take it off, slightly overlap the area that has just been performed on, and again moving up and down. Don't do too big of an area at once, because you'll tend to find it, especially over bony prominence like cheekbones or around the mouth or the chin, you'll get a little bit wobbly and you may not go in a straight line. So just perform it in a way that's comfortable for you. Taking off and reapplying. Now, the pressure you will change to whatever you feel comfortable with, making sure you're not really being really aggressive to start with, but you will find as you progress and become more confident with the treatment, you may press a little bit harder and you might start to do a few more passes. You can work up around the eye area. Work just into the hairline, because you want to make sure that you're getting the entire facial area. Just working up to the corner of the brow. You will get flushing from this treatment and you will feel a little bit tingly or prickly. You won't necessarily go excessively red, but as I said, as you progress through your treatments, you may find that a little bit of erythema or redness will come up more visibly within the skin, and it can feel a little bit hot or pulsating after the treatment. Generally the next day, you're perfectly fine. The only time I find that it will start to tingle a little bit is if you're doing any excessive exercise, or obviously if you put any acidic products on your skin, then it will tingle the next day, but generally visibly, you look perfectly fine. You can put makeup on, go to work, no problems. Once you get a little bit more savvy with your treatments and you are doing them a little bit harder or for a longer period of time, you can get little dry patches, which is sometimes what I experience, but they're very minor, and a little bit of extra moisturiser definitely takes care of that. So you can work right up under the eyes as well. So the good thing with the roller is you can go in many different directions, providing you're always going in a straight line. So again, none of this, always going with the motion of the roller. You can go on angles. It really doesn't matter. We sort of, like a star shape's the best way to explain it. But as you can see, you can do many different angles. Same with the forehead. Just going back and forth. I tell you what, this little roller will be one of the best investments you have in your home care regime. As you get a little bit more progressive with these treatments as well, you can start to apply actives straight after, but within the first couple of months of using it, what we generally recommend is applying a small amount of B2 to clean skin and then using your home roller, or using it on clean skin and applying your B2 and your moisturiser post-rolling treatment. Tilting your head to the side. So again, just down the sides of the forehead, I tend to find going on a slight angle is best. And you can see there's a little bit of pink coming up in the skin, which is completely normal. Again, you can go in different angles. How's it feeling, Lana? Is it a little bit prickly?
A little bit, but definitely bearable. Not unbearable by any means.
And to be honest, I'd probably press a little bit harder than Lana would on herself. I think it's always easier when someone else does it for you. Now, as I said, these are home rollers, so you can use them at home. Otherwise, when you first purchase your home roller, we can actually do the first treatment for you so that you get a good feeling of it and you can see the results of it as well. You can go over the nose. You do have to manoeuvre it slightly differently. It is a little bit harder. It's just smaller strokes, but again, just making sure you stay in a straight line. Great for pore refinement, anti-aging, skin tightening, resurfacing. Like it's a brilliant little tool. As simple as it looks, the effects in your skin are amazing, and I haven't had anyone that hasn't liked it. So what I'm actually going to get Lana to do now is just show you that she can do it herself, which is the best part. So if you can take that, Lana, and if you'd like to just start across the cheek for me. Yep. So all Lana has to make sure is that she's going up and down in one straight line.
And then take it off?
Yep, and reapply. When you first start doing this treatment, I advise that you do it in the mirror so that you can see what you're doing. Lana does actually have a mirror in front of her so she can see a little bit of what's going on. The biggest thing you need to be careful is that you're not just running it all over your skin as you do with a toothbrush in your mouth. You do need to make sure that you're taking it off and reapplying it before you move to a different section of the face. Do remember to do up the sides of the eyes, underneath the eyes as well, chin, across the top of the lip, nose. You can actually carry out this treatment on your neck as well, and for your décolletage. With your décolletage, you may find that you may need an 0.5, but an 0.2 is perfectly fine to start with, and a great sort of an interim to the treatment as well.
Cool.
How's that feeling?
Yeah, good. So with under the eyes, how do you do under the eye?
So with under your eyes, sorry, I'm just going to lean over a little bit here. So you just go, I tend to find this way is the best. So just walking back and forth, rolling up the eyes. Then with the sides of the eyes, I tend to go up on a little bit of an angle.
So you never go obviously below the eyebrow at all?
No.
Yeah.
No.
Okay.
Particularly with Lana's eyebrows, we wouldn't necessarily go over them as they have been tattooed.
Can you go over normal brows?
Some people do, yes. I wouldn't advise it in the first couple of treatments. And you need to be mindful if you've got any scheduled eyebrow waxing or facial waxing, please do not do this treatment within 3 or 4 days of getting those treatments done, or 3 or 4 days post-treatments as well, especially in the early days of your rolling. Straighten up for me, so the lip.
So you can't go over the lips, can you?
No, no.
And is it good to focus on like where you have fine lines and wrinkles?
Definitely, yep. So in cases of enlarged pores or the predominant fine lines that we get through the forehead or around the eyes, you can work that little bit harder if you wish. So go a few different ways when you're doing your treatments. So going backwards and forth, up and down.
If you had any open like pimples, do you just avoid them?
Yes, please. Yep. So any open wounds or scratches on the face, please go around them. Or if you're suffering any breakouts, again, just do not go over them.
So is it best to do it in the morning or at night?
The best time to do this treatment is at night. We don't advise that you put makeup on straight after the treatment, as the little needles obviously put little holes into the skin. So this allows better product penetration, and it does help to stimulate growth hormones within the skin. However, if you, as you can see, if you were to roll your skin and then apply things like makeup or fake tan, you will find that what will happen is they will sink in deeper into the skin, and then as the skin heals itself up and those little holes close over, you will find that some of those colorants can get captured or trapped in the skin, leading you to sort of a mottled colouring within your skin, which is not what we want either. So you do need to be mindful of that. So it's best to do at night on clean skin. I tend to find that I will do it maybe an hour or 2 hours before I go to bed. Gives it a little bit of time to calm down. I go to bed, wake up the next day, and it's perfectly fine. As I said, to start with, just be nice and gentle with the treatment and work your way up to being a little bit firmer with your pressure and a little bit longer in time as well. But generally, the next day you're perfectly fine. So going up and down. So you'll work your way up. Generally, we say for the first treatment you might do about 5 minutes. And then every couple of weeks you'll increase it by a minute or so here and there. You might start with doing 6 passes, working up to 8 passes, working up to 10 passes in the one area.
So this is obviously best for kind of acne scarring and fine lines and wrinkles.
Yes, any scarring, any aging within the skin, perfect, and a great preventer as well. It does prevent that breakdown of collagen and elastin within your skin. So it does stimulate the wound healing response, which is obviously going to cause that influx of fibroblast activity, which is going to lay down new collagen and elastin within the area as well. So that pretty much wraps it up. If you do have any questions, obviously feel free to give us a call. There's no general real methodical way to do it. I generally always say to people, work their way from the outside of the face in, outside of the face in, do the eyes, and then do the forehead. The reason I say this is because your cheeks can take a little bit more treatment than the rest of the face. Because there's a little bit more adipose tissue there, you tend to find you can press a little bit harder and you tend to not feel the treatment as much as well. The more sensitive areas are obviously around the eyes. Due to the ocular bone as well, there's not as much tissue supporting the area, and obviously the forehead, again, there's not a lot of adipose tissue there either. But a fantastic treatment, and I promise you, you will love it. So hopefully that gives you a little bit more insight as to how to use your home roller at home. But when you come in and purchase a home roller, we will thoroughly go through the treatment with you and advise you what's best for your skin type, at what regular treatments you should be doing, and obviously what products you can use in conjunction with your home roller as well. But again, hopefully that gives you a little bit of insight and a little bit of information into the home roller. It is a fantastic treatment and any good addition to a home care regime that you might already have.